My hair now is gray, but it was red growing up. Red hair, freckles, all of the things that you don't need whenever you're out in the sun. And that. Although I have to be fair, my mom was militant about sunscreen. And so this would have been early 1970s. I think there was one SPF and it was called copper tone, and that's it. So she, kept it on me on a pretty regular basis. And then when it was incumbent upon me to do it, I was not as vigilant by any stretch. And I did the most foolish thing a fair-skinned person could do, and I became a lifeguard. And I did wear sunscreen, but not, it would have been maybe a 6 to a whatever that was available out there. I did have some nice floppy hats, but nothing that would protect me enough down the road, i.e. 10, 15, 20 years down the road. And I think by the time I hit, 30, I had heard enough stories about skin cancer creeping up on people, and started going to dermatologists just to get skin checks about once a year. And how quickly we got to the point where actinic keratosis every single time. Every time I went, we're going to zap this and this and this and this, So here I am at 32, and they were just very honest and just said, this is going to be every time you come in because of you're fair skinned, you spend a lot of time in the sun when you're younger, and so this is just part of your life now. And so Apex is home. It's interesting because it was always this gloppy, bad-smelling stuff that you put on, did not want to, it was an uncomfortable, situation. And again, I'll say through the late 70s, early 80s, it was still that. There was quite a breakthrough. I want to say it was somewhere maybe in the 90s, late 90s, where we could spray our sunscreen on, and now we're starting to get into now it's a little more convenient. And you also get to an age where you realize you're not, a superhero, and things can happen to you. And so the sentiment around sunscreen again in early ages was, go out and you got to get a base burn. I look back, I remember hearing people say that and thinking, yeah, you're probably right. You burn, then you brown, and then it protects you, right? No, because I never browned. I was just varying shades of pink whenever I would get out into the sun. And eventually my freckles would kind of grow together, and that might be whatever protection it was. But that was the sentiment generally back then. And now it's in everything. Product after product after product says with an SPF 30 or 50 or whatever in it, which is good. I think at the time, it might have been a combination of, I'm reminded there were probably about 3 different things. My neighbors across the street who were a little bit older, it was one of those, what are you doing today? Well, we're going to the dermatologist. Really? What's going on? Well, we get our checks every, 6 months or whatever. I said, really? That's interesting. And then there was you should probably do that too, kind of a thing. It was a combination of that, and probably, at that point, I was working in TV news, and I'd probably seen enough stories about people who ended up with, high stage melanoma and things like that. And that's as dangerous as it gets. And you start to realize your mortality at that point. And that's really what I said, what could it hurt? You can only help. I spent so much of my life getting sunburnt that nothing really fazed me whenever it came to sun damage in general. Then, when I went in for my first skin check, that's when that conversation began to happen. They would wheel the table in with, the nitrogen tank. Okay, I'm going to go ahead and burn a couple of these off. And a couple of what? AK, actinic keratosis. And the explanation, and we know the varying levels of different types of skin cancer. It's just, cells overactive and, that sort of thing. And it's the early stages to understand that is what's happening is a little bit of it's a wake-up call, And I remember at the time, a dermatologist saying, this is, as I said, this is going to be part of your life. We've got some here, and here. We're going to do this. And then when I see you in 6 months, there'll most likely be some others. But we're going to get rid of these right now. The first time it happens, you're like, how? And then the recovery from it, which is just, taking care of what I guess by definition, might be a burn. You know, you're dealing with blistering and that sort of thing. And that's another part of it too. You know, you can slow that down, the frequency and the recurrence of things like, you know, AK and other types of skin cancers. And knowing what you have to go through after you get 4 or 5 or 6 of those removed, pretty soon you don't want to do that anymore. I don't want to have multiple bandages on my face and have to explain, you know, what was going on or why that was happening. So that's another way that you become a master of preventive medicine at that point, or just trying to be smart. At the home I was living in at that point, you know, we had a pool and we had a little, you know, sort of pool house, and we had this sort of shelf with just a variety of different sunscreens on it for anybody's, you know, use in differing degrees and permeability to water and that sort of thing. So it just became, if I was outside, whether I was mowing the lawn or just working outside or, you know, certainly swimming or anything like that, instantly put it on. And also now I can't remember the last time I've been outside working without a large brim hat. My wife is happy but makes fun of me at the same time. That and doesn't matter how hot it is, gloves, you know, that sort of thing, because, you know, as good as sunscreen is, you know, an actual barrier always helps, you know, in those cases as well. So it's a regular part of my life. There's sunscreen everywhere, and cover as much as I can. Anytime the term surgery, you know, comes about, there's a certain amount of anxiety that comes with that as well. And I would say the first time I had it done, I was a little concerned, mostly because it was on my face. So we were going to have a number of different aspects to this. There was going to have to be a special kind of closure and everything, you know, at the end. But by virtue of how most surgery is done, just one little bit at a time, go take a look under the microscope, see where we are, watch that cancerous region get smaller and smaller and smaller. It's much less invasive than you would think. And when you've got somebody like Dr. Garcia doing the work, you're in great hands, and you don't feel a thing. You know, I mean, there's a little, the old-fashioned, there's a little pinch whenever the local anesthesia is being done, but otherwise, knowing something that could have become a lot worse is now gone, it makes it all worth it, for sure. It's a quality team from start to finish, and one of the keys to it, in my opinion, is that, you know, there are I'm sure a lot of surgeons doing Mohs surgery and doing the preventive care as we would with Megan. It is that concern after the care that occurs that you may not get somewhere else. You know, the explanations as the procedure is actually going. Dr. Garcia will take you from start to finish out loud verbally exactly what he's doing, explaining everything that's going on throughout the process. And boy, there's nothing more comforting than that. You just really, you know, you're in good hands whenever you're here with Apex, and that is what keeps me coming back every 6 months, or in between those 6 months. If I do run across something that I just don't like the way it looks or how quickly it came on or something like that, you know, you can get same-day appointments, as we say all the time, you know. So it's you feel like you're in the comfort and the help of a great group of people. Given the amount of combined experience that is in all of these buildings across Northeast Ohio, there's nothing that they haven't seen. There's nothing that they haven't heard. If you come in and say, yeah, I'm 50, I've never had a skin check, they're not going to go, whoa, we have another special room for you or something like that. They're going to say, okay, let's get after it. There is a certain level-headed, responsible approach to everything that you have done here. And look, there have been times where I'm supposed to be here every 6 months. And there have been times where it's like 8, 9, you should have been in here, get over here. But I know that. So, you know, I don't see any issues with that at all. But the reality is, these people are here to help. And it doesn't matter if it's your first skin check or your 30th, or you should have had your 30th already. It doesn't matter. They're going to treat you well. I was already going to Apex, and this was, you know, my home base for dermatology and skincare. And one of our account execs approached me from iHeartRadio and said, "Hey, we're thinking about we're talking to Apex about possibly, you know, doing some work with them, and I said, well, that's where I go. Let me tell you, I want to tell everybody about Apex, and they're like, great, well, we'll tell them. And then, you know, Dr. Garcia knew already, and it wasn't long before we were, you know, on the air talking to either Dr. Garcia or doing, you know, commercials or the TV spots or social, or, you know, and it's because I believe in what's happening here. They're an important part, this Apex is an important part of my life. And continued life is maybe a better way to put it. And this aspect of it, whether it's me or my family members, we're here, and this is where we want to be. The interesting thing is we do an event called Miles for Melanoma every year. And that's where I run into the most people. That's where, you know, I'm lucky enough to be able to MC the event, and inevitably every year 1, 2, 3 people will come up to me and say, "Saw your spots. That's why I'm here. Apex tent's right over there, you know, and I'm going in to get a check today just in case. I got one coming up, you know, in 3 months, but I'm still going to go over there and do a quick spot check with them." And makes me feel good. It makes me happy that, you know, some people have made that decision because, you know, they heard my voice or saw my face and said, okay, if he's doing it, maybe this is something we might want to, you know, look into. So it's great. Get your skin checks. Just do it. I don't care if you're 12, 90, doesn't matter. And again, there's nobody here that hasn't seen whatever you have going on. So come on in. There's no embarrassment and there's no shame if you've not been in for a couple of years to get your skin checked done. Apex Skin is here for you.
So when a patient comes to me in kind of early adulthood like Mark, one of the most important things is I take a look at their skin type. He's got blue eyes, light skin, and that's the most for risk factors when it comes to skin cancers, and especially pre-skin cancers. So of course, talking about family history, is there any history of any melanomas, and exposure in the past to sunlight and burns. Also a big one is tanning bed use. Even one exposure to tanning bed use can increase the chance of melanoma in patients like Mark. Most of the time patients, when they come in, they have a little bit of trepidation, but I quickly put them at ease, just letting them know that yearly skin checks is really the best way to prevent any of these pre-skin cancer from actually becoming a real skin cancer. And most of what we do in dermatology is preventative. It's cheaper, it's going to be better for the patient in the long run, because if they can prevent even getting the skin cancer, that puts the patient at ease. One of the biggest takeaways for the patients also is a lot of the damage has been done from age 0 to age 20. A lot of my patients, especially in young adulthood, they say, oh, well, I'm really good at wearing sunscreen now. Unfortunately, a lot of the damage has been done, so we're kind of playing catch up, especially patients had a lot of sun exposure and have kind of that light skin type, light eyes as well. So I think that's surprising to patients, is you can still be at risk for getting those skin cancers even if you started to wear sunscreen a little bit later. But the good news is it's never too late to start wearing sunscreen. I recommend 30 SPF or higher for all patients, regardless of risk factor. That's going to go far beyond just preventing skin cancers. It also helps with preventing wrinkles and anti-aging as well. I tell them, well, you're here now, and that took a lot of courage for you to come today, and I'm really proud of you, and I'm going to see you yearly at least, and if anything indicates that I need to see you more frequently because maybe you get a basal cell skin cancer, or maybe you have a family history of melanoma, then maybe we see you twice a year. But that's something that we're going to have a conversation about every time you come in for a skin check, and it's really conversational. And in dermatology, we have the privilege of really forming relationships with our patients, so it's not a one-time conversation. It's every single time the patient comes in to see me, we're talking about their skin, we're talking about their family members. They're like family to me, and I know them personally, and I think that's the most important thing to developing that patient relationship and helping prevent them getting skin cancer in the future. If something is concerning, I would recommend a biopsy of the spot. So a biopsy involves, of course, numbing the area with a numbing agent so that the procedure is painless. After the numbing agent goes in, the patient doesn't have any pain, and sometimes a biopsy looks like just a little skin scraping. Sometimes we have to take a little bit deeper of a biopsy depending on the lesion. We have our own dermatopathologist here at Apex, so that helps with turnaround time in terms of how much time the patient is waiting to get their results. So quickly after the biopsy is done, my team team packages the biopsy specimen, and then we get it ready to send to our lab. The lab's right here in our building in Mayfield Heights here at Apex, and that really helps our dermatopathologists really to kind of speed up the time with which they read it. And then as soon as we get the results, we call the patient. If something extra needs to be done because it is a skin cancer, we're able to treat that here. Our Mohs surgeons can then treat any types of skin cancers here, and we let the patient know, and we schedule them when we call them with results. So Mohs is a wonderful cosmetically sensitive skin preserving procedure to treat non-melanoma skin cancer. So we're talking about basal cell skin cancer, squamous cell skin cancers. And when I say cosmetically sensitive, what happens is the least amount of skin cancer possible is taken from the skin in order to preserve as much of that healthy tissue as possible. So areas on the face, the neck, the ears, the tops of the hands, the arms, the fronts of the bottoms of the legs. These are all areas where Mohs surgery can be appropriate for our patients who do develop these basal cell skin cancers or squamous cell skin cancers. So when the patient has the Mohs surgery, they come into our office, they're numbed in the normal fashion with the numbing agent. The Mohs surgeon then comes in and removes the skin layer by layer, and then the Mohs surgeon is actually also the pathologist. So the Mohs surgeon not only performs the surgery, their team preps that skin, puts it on slide so it can be looked at under a microscope. The Mohs surgeon then performs and acts as the dermatopathologist and looks under the microscope to tell if the margins are clear or not. If the margins are clear after one layer is taken, then the patient's done. They might get sewn up, some stitches, or the lesion might be healed to secondary intention without stitches, and that's up to the Mohs surgeon. If on the first layer it's not clear, the margins are not clear, then the Mohs surgeon comes in and takes layer number 2 only in the appropriate areas where there's still a little bit of skin cancer left over. So it's a very precise technique to remove skin cancer. It's never too late to start. I had a patient come in today for their first skin check and they were like 75. And so it's never too late, because if we find something, most of the things that we find in dermatology are really highly treatable when caught early. And so the more the patient comes in to see us, even if they're 75 years old and it's their first skin check, most likely they're things that we're going to be able to catch and treat and then talk to them about prevention from here on out. Most people ask me, what sunscreen should I be using? Like, what do you recommend? And I just had she's probably 13 or 14-year-old girl ask me that. And I told her the sunscreen that you're gonna wear is the one that I recommend. As long as it's 30 SPF or higher, I don't care. Is it chemical? Is it a mineral blocker? I don't care if it's a stick formula. I don't care if it's a spray sunscreen, although sprays do have to be rubbed in. I always recommend, if you do the spray for kiddos, it's really convenient, but follow them and make sure you rub that in. But it's the sunscreen that the patient likes and that they're gonna actually use. We have the benefit of being able to give our patients a lot of samples, so everybody who asks me, what sunscreen do you recommend? 30 SPF or higher, and here's a bag of samples to take. If you like them, you can buy them all over the counter at the drugstore, so they're easily accessible. A lot of misinformation about the dangers of sunscreen, and I think it's a terrible narrative for dermatology, specifically for the risk of not using sunscreen, and it's not based on real science. And there's been nothing that has proven that sunscreens can cause cancer and they are bad for you. To take one thing away from this conversation, it's early skin checks. Come in for your skin check, even if you've never had one before. The mole check, most people are surprised that it only takes a few minutes, 5 to 10 minutes at max. It's very comfortable. You're in the room for only a few minutes and we can make sure that there's nothing to be concerned about. So come in for your skin checks. Melanoma Monday is May 4th, and we can't wait to see you at Apex Skin.